And now David will read our scripture for today.
Today's scripture is from the Gospel according to Luke, chapter 4, verses 14 through 30. So Jesus returned in the power of the Spirit to Galilee, and the fame about him went out through all the country about there. And he taught in their synagogues and was praised by every man. And he came to Nazareth, where he had been brought up, and he entered the synagogue on the Sabbath day, as was the custom, and stood up to read. And the book of the prophet Isaiah was given to him. And Jesus opened the book and found the place where it was written, "The Spirit of the Lord is upon me. Because of this he has anointed me to preach good tidings to the poor, and has sent me to heal the brokenhearted, and to proclaim release to captives, and sight to the blind, to strengthen with forgiveness those who are bruised, and to preach the acceptable year of the Lord." And he rolled up the scroll, and gave it to the attendant, and went and sat down. And the eyes of all who were in the synagogue were fixed on him. And he began to say to him, "Today this scripture is fulfilled in your ears." And all testified about him, and were amazed by the words of grace which came out of his mouth. And they said, "Is not this man the son of Joseph?" Jesus said to them, "You might probably tell me this proverb, 'Physician, heal thyself.' And all that we heard you did in Capernaum, do also here in your own city." Then he said, "Truly I say to you, no prophet is acceptable in his own city. For truly I say to you, there were many widows in Israel in the days of the prophet Elijah, when heaven was closed for 3 years and 6 months, and there was a great famine throughout the land. Yet Elijah was not sent to one of them, but to Zarephath in Sidon, to a widow. And there were many lepers in Israel in the days of the prophet Elisha, yet not one of them was cleansed except Naaman the Aramean." When those who were in the synagogue heard these things, they were all filled with anger. And they rose up and took him outside the city, and brought him to the brow of the mountain on which their city was built, that they might throw him down from a cliff. But he passed through the midst of them and went away. And now Reverend McCauley will give us our lesson sermon.
Well, good morning. Today's lesson is on realizing health in turbulent times. And I originally planned to give this sermon last week, but I guess it's still timely. And actually, I wrote the basis of this morning's lesson several years ago in response to the coming of the potential threat of the bird flu. And while the truth doesn't change, it appears that the context in which we get to learn about and develop our understanding of the truth does change. It appears that the threat is not as great as originally predicted, but this lesson is just as timely as ever and bears repeating. Once again, I'm glad to be home after a week on a giant cruise ship in the Mexican Riviera. Apparently, I arrived home just in the nick of time. On Saturday morning, just 2 weeks ago, just before we disembarked from the ship, CNN began news stories about the swine flu. So when we got back home, David and I quickly checked the internet to see if there had been any outbreaks in the ports we visited. Fortunately, there were no reported cases, and since we didn't travel through an airport, I was relieved. This reminded me of the time 3 years ago when we came back from the Caribbean after a 2-week cruise, and the first news we heard was all about the bird flu. And now it was being suggested that we should all stock up on canned goods such as powdered milk and all kinds of other supplies like non-perishable foods, waterless cleaner, bleach, and so on. It occurred to me that after all the hype about the coming of the bird flu, the devastating predictions we had heard never amounted to much. The bird flu never impacted my life in spite of all the talk we had heard on television. So once again, the talk on television was all about the devastating potential impact and consequences of the swine flu. Fortunately, most of this talk has not amounted to much. It also occurred to me that as I was hearing all this talk, that our fearmonger, who has seemingly taken such delight in promoting fear for the last 8 years, was no longer in office. and that perhaps the newsrooms were filled with glee at the possibility of a new epidemic, so they'd have new stories to report and could therefore sell more advertising. In the past, I've mentioned that in studying the ministerial courses in the National Academy of Metaphysics, one of Dr. Bassell's first admonishments is never to make any promises to anyone when you don't have control of the outcome. The day I promise that the sun will rise tomorrow, it just may not happen. That's an important lesson. What Doctor also says is that it is the job of the Chirothesian minister to suggest alternate approaches to thought other than the obvious ones. Many of us in class have studied the course of the Auric Shield. Those graduates of the 8 courses have studied the Auric Shield to the extent that they know it. And some have studied it under the name Ring Pass Not. Even before I met Dr. Gard or heard about the Auric Shield, I knew that I was protected by it as a child and as a teenager. I can't tell you how it looks, what color it is, what shape it takes, or how big it is, but I know that it works, and that it's real. I imagine that many of you have had similar experiences when you were protected and couldn't understand how or why. As a minister, I can't promise you that you won't be affected by the swine flu, and I can't promise you that you'll always be protected and safe. However, I can suggest that you always use the Auric Shield hourly if you have to do so, and that you choose not to buy into the media hype. The media is having a field day filling our mentalities with fear. Why? Because they will sell more newspapers, magazines, radio and television commercials, and all kinds of food and supplies. I suggest that when you hear about the swine flu epidemic, you smile to yourself and remember that all the hype is a sales job. Don't buy into it. Remember Louise Hay? She was diagnosed with cancer, and the doctors wanted to cut her guts out. She refused to accept the diagnosis. She meditated, prayed, and changed her diet, and it wasn't long before the cancer was gone. Last time I heard, she was alive and well and living in Solana Beach. If Dr. Gard were here today, I believe she would be reminding you to place a sentry at the third eye and screen every thought carefully before allowing it into your mentality, and guard your mentality carefully. I've taken it upon myself to convey this message to you as I know Dr. Gard or Dr. Middleton would do. Don't buy the hype. You have a choice in what you think. Use what you know and what you have learned. If you ever find yourself in doubt or fear, call one of us. Call Dr. Lyle or call me or any other minister or practitioner and ask for counseling. In the midst of fear, you may need someone to remind you of what you already know you know. Never be afraid to ask for help. It wasn't long ago that we were told that the country would come to a standstill with the threat of Y2K. The media and the software companies made lots of money instilling fear into the minds of businessmen all over the world. We were told elevators were not going to work, transportation guidance systems were supposed to fail. We were told there'd be devastating consequences because of the coming of the new millennium. We can now look back and have a good laugh knowing that all that expense and fear was just a bunch of baloney. But at the time, we heard about people stocking as much as 6 to 12 months worth of emergency food and supplies due to fear. The suppliers made lots of money due to fear. Also understand that I'm not saying that we won't have devastating consequences. It is possible that we may watch many people succumb to the fear and become infected and die. Nonetheless, it's important to remember that you don't have to succumb to that fear, and you don't have to be part of the epidemic. In the event the epidemic really does manifest, consider the possibility that you have the option to coexist in the world with the epidemic without being part of that epidemic, and it doesn't have to affect you. Also remember that the Auric Shield, as powerful as it is, does not give you license to act recklessly, carelessly, or foolishly.